Thank you so much, Blessings. I would say that the healthcare system in Nigeria is set to face a major disruption within the healthcare service delivery as the planned warning strike commences tonight. I mean, Wednesday by 12 midnight. So some of the demands of the midwives and the nurses, these demands they have been asking and clamoring for over the years. It's not today they started this. And the strike is set to affect 74 federal hospitals and other state hospitals and primary healthcare centers, with services expected to paralyze, I mean, total shutdown, because although it's a warning strike, but as part of their demands would be that they are asking for upward review of shift allowance, uniform allowance adjustment, a separate salary structure for nurses, increased core duty allowance, mass employment of nurses, and the establishment of a nursing department in the Federal Ministry of Health, among others. And I have been speaking with some of the nurses who form part of this union, and also residents in the FCT. And part of the fears of the residents in the FCT would be that we know that the healthcare system, the people in the healthcare professionals, they do not work in silos. They work together. It's an ecosystem of healthcare professionals, body. And once the nurses, who are an integral part of the healthcare service delivery, once they decide to go on this particular strike, although it's just a 7-day warning strike, but then they are saying that once the government doesn't call them back, attend to some of their demands, they will go on a full-fledged one, and then they'll decide on what else they will do. But fears among the residents would be that we have mothers, we have infants, we have children, babies, the postnatal wards, antenatal wards, and all the maternity wards in the hospital, and even accidents and emergencies. There are nurses who are on standby to attend to some of these cases. But then when they now proceed to go on strike by midnight, now that there is going to be a total collapse of the services. And then it's just going to take a toll. And then you can also agree with me that there's also the Jaffa syndrome. A lot of nurses have traveled abroad. I even tried to reach out to about 2 nurses before I got the 3rd nurse. And the 2 of them, one said she's already in the UK, and the other said she's in Saudi Arabia. Why did they travel abroad? Because of the poor welfare system, amongst other demands they are asking from the government. So this is the issue that most of the public healthcare advocates are saying, that the government has to do better, the government has to do more, so that this does not happen, so that the integrity of the healthcare system can be protected.
All right, thank you so much, Aisha. Thank you so much. We can see that it's raining where you are. Thanks for giving us the update regardless. Please find a shade. Thank you so much for giving us the update despite the rain.